Okay, so I think it should be recording now. Hi, everyone. Thank you so much again for coming to this event. Again, my name is Emily. I'm the Executive Director for the Yale International Relations Association, and we are so excited to be co-hosting this event today with the Alliance for Southeast Asian Students, Yale Women's Leadership Initiative, as well as the Yale Indonesia Association, or Indonesia Yale Association, excuse me. And so just quickly to introduce Ms. Thomas. Ann Thomas leads the Water, Sanitation and Hygiene WASH program at UNICEF Indonesia. She is an environmental engineer with over 2 decades of development experience within the UN system and aid organizations in Latin America, Africa, and Asia. And today she'll be speaking about the opportunities and challenges of the COVID-19 crisis for the water and sanitation sector. So with that, I'd love to introduce Ann Thomas. Thank you.
Okay, thanks very much, everyone. And so today I wanted to speak to you a little bit about the work that I'm doing in Indonesia at the moment, working on the COVID response. I work for UNICEF in Indonesia, and I lead the Water, Sanitation and Hygiene program, which, as you can imagine, plays a very strong role during the COVID crisis that we're going through in Indonesia. But it also presents some, interesting questions and opportunities, and that's what I wanted to speak to you a little bit about today. So I'll talk for about 20 minutes, and then we'll have a break, and you can ask any questions that you have. So I've titled this "Advocating for Transformative WASH During the COVID Response Effort in Indonesia." And when we talk about transformative WASH, what we mean is the full package, the water, the sanitation, and the hygiene services. It's not enough to give people water supply, or it's not enough to give people a toilet, not enough to just teach them about hygiene. You really need to have the full package in order to have the full benefits. So just a little context on Indonesia. We are the second in the world for the number of open defecators. So we have about 25 million people that do not have a toilet and go to the bathroom outside. We have 7% access to safely managed sanitation. And we don't have an official figure, but we have under 10% access to safe drinking water. So what that means is most people have a toilet in their house, they have a water supply in their house, but the problem is the toilet doesn't connect to anything and the water is dirty. So you will get sick if you drink the water out of the tap. So when we talk about safely managed sanitation, it's really about, having safe to drink, safely treated services. We know that our baseline hand washing practice is around 30%. Coupled with this is what Jakarta looks like. It's a booming city. It's a mega city with 10 million resident population, but that can go up to 30 million in the daytime with all the commuters from surrounding areas. So that's effectively the population of Canada in one city. Most people rely on on-site sanitation, which is something that I've shown here in the diagram, which is basically, in theory anyway, where someone goes to the bathroom, that septic tank is then pumped to a truck, it then goes to a facility where it's treated, and then it's safely disposed of in the end. This is a very idealistic scenario. Most people in Jakarta have just this first picture of the guy sitting on the toilet, and that tank underneath is essentially an open pit under their house. To compound this, we are also extremely prone to disasters and climate change and water-related risks like flooding and tsunamis. In the nearly 3 years that I have been in Indonesia, we have had over 2,500 earthquakes, 3 of which caused tsunamis and massive disruptions. We've experienced droughts, flooding across the country. So as you can imagine, the state of water and sanitation is a really critical baseline issue in Indonesia. So just to give you a little bit more on services, since I'm talking about COVID today, I just wanted to tell you a little bit about what happens in healthcare facilities in Indonesia. Now, this is a map of Indonesia, and it's made up of over 16,000 islands, stretching, a span of basically something similar to the Atlantic Ocean. So 7-hour flight from Aceh all the way over to Papua. A puskesmas is a health center. And what we have seen is that less than 50% of them have a hand washing station in the room where babies are born. We also know that neonatal mortality rates are really high in Indonesia, and that hasn't changed in 20 years. So nothing that we're doing in Indonesia now has changed that, but we do know that there is no soap and water in delivery rooms, and the majority of babies are dying from basic infections. In the COVID context, this has obviously become an issue because we're looking at hygiene and the ability of these centers to provide hygienic services. When we look at the statistics for healthcare facilities, what we see is that water is usually available, sanitation is roughly available, but when it comes to hygiene, we know that there is soap and water somewhere in the healthcare center, but it's not necessarily in the treatment rooms. It's not necessarily near the bathrooms. We don't know where they are. So there's room for improvement, but we basically classify it as limited service. If we look at access to wash in schools, so water and sanitation in schools, we see that roughly 35% of schools have access to water, but 15% have access to proper latrines. And then we also look at same-sex functioning toilets, so that it means girls' bathrooms and boys' bathrooms. And the reason we do that is because what we have found around the world is that usually girls, especially when they get their periods, if they don't have proper toilets at school, they'll often not come back to school. So they will drop out around that age because they don't have proper facilities for menstrual hygiene. And of course, some of these figures differ across whether you're talking about public and private schools or rural or urban. Typically, urban schools do better, private schools do better, but we're still seeing that it's not a great situation when we look at the majority of schools in terms of access to water and sanitation. And you can just imagine yourself as a child in a school where you can't go to the bathroom. It's not a great context for retaining students. If we then look at how this all translates in terms of health outcomes for children, we know that Indonesia is the 7th in the world for stunting, 2nd for open defecation, as I said. We also see that some of the statistics for child mortality are very similar to what we were seeing in the 19th century in countries like the US. So diarrhea, typhoid, cholera, polio, hepatitis A, these are the top killers of kids. And we know that 90% of diarrhea is caused by some kind of fecal oral transmission. We also know that this chronic gut infection, so when children have a high fecal exposure, that means that there's some kind of feces in the environment, whether it's in their water, whether it's in the sewers, whether it's in the backyard where they play, that they develop gut infections, and they become, they have reduced immunity, it exacerbates malnutrition, and we know there's a link between high fecal exposures and stunting rates globally. Okay, and then of course, finally, COVID rates are increasing in Jakarta. We are increasing our testing capacity, and as that gets increased, we're finding more and more cases. There's deaths that are slowly climbing. So Indonesia, in the late 90s, experienced a huge economic collapse. And the government is very scared because basically what the data are showing us with COVID is the only thing that is stopping transmission right now is shutting everybody down and nobody moving. So what they've been using this Facebook data to track people's movement, and what they've been finding is the more people move, the more transmission increases. But that was not going to be an option for the government of Indonesia. They do not want to put businesses out of business, people, small shop owners out of business. They want to keep everything running. So, what they looked at secondly, instead of this mobility issue, is hygiene. And so what they're seeing from the evidence that's out there is that hand washing with soap can reduce the risk by 35%. Using a mask can reduce it by another 35%, and then social distancing by another 10%. So the government of Indonesia decided that they would take on a hybrid approach. And basically what they've done is they have, they've had the 2 lockdowns this year. We're going through a lockdown currently, but they had one earlier in the year, and they found, yes, of course, transmission really stopped. They closed things down during Ramadan this year, and in May and June, everything stopped. But they realized they had to open. And so they started this new approach looking at systematic hygiene promotion in public places. And so that means taking the 3 behaviors that I talked about, hand washing, mask use, and social distancing, and put it into this package where if people go to the office, they must maintain these procedures. So offices are required to do it. The malls are required to do it. The only thing that they have done, though, is that they have closed schools. So unfortunately for children in Indonesia, they have closed schools, but they've opened everything else. And so the immediate impact on children has not been great. Most children are now in online education, including my own children. And the quality of that kind of education varies dramatically across the country. And of course, many children in Indonesia don't have access to the internet or to computers. So, the quality of education that children are experiencing this year has gone down dramatically. We're seeing more children going to work to support families during the crisis. We are, of course, it has lowered COVID cases in children. And because of some of the issues I mentioned before about stunting and malnutrition, Indonesian children seem to be more susceptible to COVID than children in other countries. So we are experiencing lower COVID cases in kids, but the overall impact on children seems to be outweighing the health impact, sadly. But there is some bright news in this. From a water and sanitation perspective, there's been a few opportunities. Sorry, let me just go back to that. One, there's been a huge attention on hand washing with soap as a do-it-yourself vaccine. And this is, for some of the reasons I've already shared before, there is good evidence to suggest that if we can hand wash with soap, that we will be able to mitigate transmission. A lot of the work that we did at the early part of this response was dedicated to providing the government with support in developing hygiene protocols for public places, for schools, for mosques, for marketplaces, to help supply some critical hygiene items like these hand washing stations, soap, making sure these were getting out across the country. UNICEF also plays a strong role when it comes to cluster coordination, and that means, supporting all different agencies working in the wash sector to provide services where it's needed. So we have a good mapping, and that map in the corner is something produced by our wash cluster that will tell you who's doing what in a particular area. We've also, because we're trying to normalize hand washing with soap as a mainstream practice, we've engaged the private sector. So we now have a private public coalition for hand washing that is actually going to launch on Global Hand Washing Day this Thursday. And that means that a lot of these companies are now going to be promoting hand washing with soap in their marketing. They are going to be promoting hand washing with soap in their companies, in their factories, in how they do work. And we're looking at more creative ways that they can support normalized hand washing across all segments of society. We also have a request from the government to institute a national hygiene behavior change capacity building initiative. And so what that means is, we have a lot of programs that work directly with communities in Indonesia. And one of them is the National Sanitation Program, of which hand washing is one of the behaviors that they look to strengthen. So the government has asked UNICEF to help design a training program that will improve the capacity of frontline workers to convey behavior change messages to communities. So that's something we're also working on. And at the same time, the government would like to track these behaviors that they're looking to change nationally, the mask usage, the hand washing, and the social distancing. So collectively, this hygiene approach that the government is taking is called the 3 M's. So in Indonesian, it's, you know, the hand washing with soap, the mask use, and the social distancing. So it's called the 3M approach. So I wanted to share with you a little bit of the data that we've just started getting in the last few weeks. And this is from a real-time monitoring of what people are doing as they enter schools, mosques, other religious venues, markets, public transportation hubs. So essentially what we're seeing is that roughly 70% of the hand washing stations are functional. That means they actually have water in them, and they have soap available. So that was one. What the other thing that we were finding is that, sorry, I'm just trying to get my, there we go. Okay, yeah, so that means about 30% of the hand washing stations were not functional. So the rates of hand washing we were looking at were actually in the remaining 70%. One interesting finding that we found with this is that when there was some kind of an attendant standing at the hand washing station, people seem to double their practice of hand washing. So if there's a guy outside the mosque saying you have to wash your hands, then somebody will wash your hands. But you know, the level of like the baseline, I mentioned at the beginning that the baseline level of hand washing is 30%. That hasn't gone up very much during the COVID crisis. But what has gone up is mask use and safe distancing. So I find this interesting because hand washing is the one that gives us the most impact, but yet the things that people seem to want to do are masks and safe distancing. And it seems that hand washing is the hardest to change, because you'll see for masks and safe distancing, it doesn't go up as much when there's somebody watching. People are doing it on their own. But for hand washing, for some reason, you know, they need someone there watching them to actually to do it. So this is just a few of the, you know, the key findings that we got from this initial data. But the thing I wanted to kind of highlight to you is this idea of transformative wash. What we're finding is that, I mean, two things. We know that hand washing can cut the transmission of diarrheal disease by about 47%. Okay, that is kind of the globally accepted figure. But, you know, when we do studies of doing one part of the package, so if we go in and put clean water in, or if we go in and put toilets in, and we don't do the other things, we usually don't get these high rates of impact. And so I think the opportunity for Indonesia is, in a way, looking at this, that yes, we need hand washing, but we also need hand washing in a context where people also have access to safe drinking water. People also have access to safe toilets. So they're getting this sort of transformative benefit of these interventions. And particularly if we're thinking about children and trying to get some kind of opportunity for children out of this crisis, you know, it's really saying it's not just about hand washing, but we need the full package if we want to make an impact on diarrheal disease, on pneumonia rates, on neonatal mortality. There's so many. If we want to basically move Indonesia out of 19th century illnesses, we need to actually take this opportunity now when hygiene is in the spotlight to push for the full package of services. So I guess that's the second opportunity now is, you know, that we've been looking at how do we push beyond hygiene at establishing essential services in Indonesia. And one of the opportunities we had was with the schools in particular, because the government has now said that they would reopen schools if they had water and sanitation services. Well, as I showed you at the beginning, more than half of schools don't have water and sanitation services. So UNICEF has been really active in trying to work with provincial governments to look at, you know, what it would take. So this fuzzy chart you can see in the left here is basically what we call a costing tool. So we're looking at, you know, the status of schools in a province, what it would take to, what it would cost to actually upgrade school facilities, where the funding is available, because in a country like Indonesia that's middle income, there is actually a lot of funding that's available centrally that often doesn't get used subnationally. And so sometimes the trick, especially in a country as diverse and spread out as Indonesia, is to work with the local government to look at how they can secure some of the funding that is available. We've also been helpful in this in getting local NGOs who are available to also support the provinces in this, people who have the capacity to help build some of the facilities required. We've also looked to get a better understanding of service gaps, because we really feel like this is our moment to really talk about the water and sanitation sector while the country is thinking about pandemics, while the country is really focused on their underlying vulnerability to this disease, this very basic disease, which has come in and shut down the country. It's a great opportunity to present to the government, the variety of service gaps that exist and the role that water, sanitation, hygiene can play as a basic frontline barrier to cutting transmission. So we looked at another thing during the COVID crisis, which was, how is this crisis having an impact on people who provide basic services like desludging and this kind of service in a city? And the top three challenges that we found were there was a decreased demand for desludging services. So people, due to economic hardship, were not requesting services as much. A second thing that we were finding is that because a lot of streets had shut down out of fear and not wanting people to come in, that a lot of these sanitation service providers were not able to access customer areas. A second, impact on the part of local government was that their budgets were being diverted to really basic COVID response mechanisms, and so this was being diverted from desludging services and from pipe networks. So it was having an impact on the type of service that the municipalities were trying to provide. There was a discontinuation, ironically, of health promotion programs by local government because they wanted to divert these same staff to other COVID response responsibilities. And then there was no budget available for health and safety equipment for workers. And this was one area that UNICEF and many other development agencies tried to help the government with. Okay, so sorry, so just looking at some of the sort of long-term benefits that we saw, is really around this advocacy effort that we had using data to try and convince the government of the need for some of these investments. Looking at this national hygiene behavior change program as a way to increase the capacity and the attention to this area that is so critical. And then also we looked at establishing a public-private partnership with the private sector to sustain hand washing with soap and make sure that the behavior was mainstreamed on many different fronts and different channels. So I think overall, and maybe just to conclude, I think I've shared with you some of the work that we're doing in the COVID response in Indonesia. I wanted to highlight to you some of the advocacy opportunities in light of the fact that we are now collecting data on behavior change across the country and monitoring what people are, how this data can be used at a subnational level, for example, to strengthen a particular effort in one province, because we now have data at the provincial and district level that shows, okay, it seems that people are washing their hands when they go into a mosque, but they're not washing their hands when they go into schools or vice versa. So we have a lot of very detailed data on behaviors now that are coming out each week across the country, and that's giving us a lot of opportunity to advocate to different parts of the country and to support, more tailored responses across the country. We have this continued partnership with the private sector that has been now strengthened and helping us to mainstream hygiene in workplaces and different avenues. And I think the focus of the government of Indonesia on keeping everything open right now has also sort of reinforce the need to partner with the private sector to make sure that, businesses are conducted safely and in a way that, are consistent with preventing transmission of COVID. I think we've also tried to make the case during this emergency that, WASH sector development represents also a way to support local economic development, because there's a lot of jobs that are possible to be created when you look at, reviving a sector like the WASH sector, which, requires so many different parts, from the upgrading of facilities at a household level to collection to treatment. All these parts of the infrastructural service require jobs and workers. So we're really trying to push, sector development as a way of also supporting local economy recovery, because this is a priority for the country right now. We are also looking at how to leverage this 3M data that we're collecting to support ongoing improvement to hygiene behavior and services. And then finally, one thing we are trying to push as kind of the cherry on top is this idea of transformative WASH services to have a much broader impact on child mortality rates in the country, and to think beyond COVID to, the real opportunity here that has presented itself to fortify the country for any future pandemics. And I think I will end on that note. So thank you very much, Emily and McKenna and the group, for organizing this, and happy to take any questions.
Hi, I'm just curious about your own career trajectory and how you were transitioning from environmental engineer to heading up this program.
Okay, no, that's a great question. It's Maddie, yeah. That's a great question. So I did my engineering degree at Johns Hopkins University, and from there I met a professor actually who was doing work on the water and sanitation sector, and he taught a course called Public Health Engineering, which for me was kind of mind-blowing. I found it so fascinating because his research was basically on the Democratic Republic of the Congo, and he was showing that more people were dying from water and sanitation related diseases than they were from violence in the war. And for me, that was really profound, and it seemed like a really forgotten sector, which 20 years later it still is, and it's very true today. So I took a position with the World Bank after I graduated. I actually came to Indonesia as my first tour. And yeah, my trajectory was basically Indonesia, back to Canada with a development agency, then back to New York with the UN, and then flipped over to Kenya with UNICEF, and then again here in Indonesia again, kind of full circle. But yeah, I think, generally in development, I don't know that there are any clear paths for people. I think sometimes it's, you want to do development work, you may have an idea of one thing you want to do, but then fortune or the exposure you have may inspire you to go in a different direction than maybe you initially thought. And as I was saying to a group of Jackson students earlier this morning, I was really interested in all the engineering parts, the pipes and designing plants, but I don't do any of that now. Most of my work tends to be policy level work, and I'm constantly learning, which is something I really love about my job. It's always changing. The challenges are so multifaceted that we're constantly having to adapt and reinvent ourselves in a way.
Thank you.
I see a hand from Al Lim. Hi, Al.
Hi, thanks, and appreciate the talk. Super interesting. I'm a PhD student at Yale doing anthropology and environmental studies. So I'm looking at water, potentially a lot more in Southeast Asia as well, and specifically Laos. So I just had two questions. One was about water, like where does the water come from, and how, and how does the system work in Indonesia? Is there differentiation when it's like urban versus rural? I know it's a very broad question, but I was just like wondering if you can just shed a little bit more light about how you're seeing the water systems being managed. And the second is about the role of technology. I think the water sector, a lot of, like, even in Singapore, where I'm from, a lot of people are complaining like no one cares about WASH. So I'm wondering, like, what's the role of technology in WASH, or how are you seeing that from UNICEF as well? Thank you.
Yeah. Thanks, Al. That's a great question. So for water sources, in Indonesia, obviously, it's going to vary everywhere. But in Jakarta, if we take Jakarta, which I think is actually kind of a good example, for not even just urban areas, but also a lot of rural areas in Indonesia, the primary water source is groundwater. And so most households have a well. They may also buy bottled water because it's generally known that the water from your well is contaminated, because like I said, we all have open pits under our house, our neighbors have it, and then you have your well. So it's a bad situation, but the majority of people will have a well, and they will have some kind of a treatment system at home to treat their water, which still doesn't guarantee drinking water quality. And so that's why people then revert to an external provider to provide those big gallon barrels of water. But unfortunately, we're just doing a study now, and we have found that the poorer segments of the population are using the groundwater, and the wealthier you are, the more likely you are to have a filter on that water system, and then wealthier yet, you're buying bottled water, which is actually quite expensive. If you can imagine having to always buy your water that you use out of the tap, it's, and that's what you use for cooking, that becomes very expensive after a while. So not everyone can afford it. So what we're thinking is about 50% of the population is using this kind of groundwater, which is known to be contaminated. So, I mean, we did a study in one of the cities in Indonesia just to show the government, that please don't feel very happy about what's going on right now. Just because everyone has drinking water in their house, it doesn't mean it's a good situation. And what we showed was that there was 90% fecal contamination of the water coming out of the taps, which suggested that there was this cross-contamination of the water supply. So that's your first question. So the water source, typically groundwater. It's also why people say Jakarta is sinking, which it is, because the land is subsiding. People keep pumping the aquifer under Jakarta, and it keeps sinking. Obviously, other parts will use other sources, but it seems to be predominantly groundwater. On the role of technology, I think I do think there is a bigger issue here in terms of these mega cities and how countries are developing very fast and urbanizing fast. And, the traditional systems that we have in the West of sewerage systems just don't always work. And it's very hard to retrofit a city like Jakarta with a sewerage system. It's just impossible. It doesn't follow any kind of known grid. It's, teeming with people, super dense. It becomes very hard to do a traditional sewerage system. So now we're looking at different ways that waste can be treated, because essentially you've got such a range from that septic tank you have at your cottage. I don't know if you guys have cottages here in Canada. Cottage is a really common thing, but a cottage, by a lake somewhere in the middle of nowhere where you have a septic, that's what Jakarta uses. So we have these really basic systems that are being used, and then you have sewerage over here, and there needs to be something in between these two systems. And so there is actually a lot of research going on now. You've heard of the Gates Foundation and all the research they have done to reinvent the toilet and look at how could we design a treatment plant on site? Like, is it possible to design a toilet that doesn't cost $5 million that can convert all the waste into something usable and clean on the spot? And we're not there yet. And actually, in Indonesia, I do a lot of research on this now. We've just done a sort of a market survey of all the companies out there, all the different options that are there, why people aren't using them. And we're basically trying to excite the private sector on this business opportunity. There really is an opportunity here to serve people with a different kind of system, and who wants to innovate. So there are some companies out there like Lixil is one. They have a company called Sato, and Sato has been looking at these kind of low-cost toilets for bottom of the pyramid populations. And so there really is a market for sanitation. I think it's just we haven't come up with all the right, we don't have all the answers yet on how we can support governments like Indonesia to do this better. But the baseline at the moment is upgrading septic tanks, getting some kind of a pumping service, and then treating it at a treatment plant. That is sort of the baseline model that cities like Jakarta are kind of going toward.
Thank you.
Welcome. Cristobal.
Hi, thank you for this. I wanted to ask you, it seems like you're relying a lot on behavioral change. And what strategies were you pursuing to do that? There's a lot of talk nowadays in policymaking about nudging theory and behavioral science. On how are you trying to address these behavioral messages to change practices in hygiene?
Yeah, no, it's a great question. Okay, so for hand washing with soap, I think sort of the way that the sector has been developing is we really feel like it's important to build on what people's motivations are, what we know are the drivers for behavior change, right? And for hand washing with soap around the world for the last 20 years, there's been a lot of research on what drives behavior change. And what we're finding time and time again is that there are something called the universal motivators of behavior change, and they are disgust and affiliation. So disgust is when you feel like there's something dirty on your hands and you want to get rid of it, right? So a lot of behavior change programs are based on making people feel like there's something dirty on their hands. So germs, like the presence of germs. The other one is affiliation, which is like peer pressure, right? So sometimes we'll try and make the hand washing station really visible outside the bathroom because we want people to feel like other people are watching whether they've washed their hands after they go to the bathroom. So, and sometimes in our behavior change programs, we really build on that. So we try and create this kind of civic duty that everyone needs to do this, not just for themselves, but because they need to protect their friends. And so people need to monitor. And even in our 3M approach that we're doing now with this monitoring of behavior change, we are subtly trying to build that in because we're planning to open this up to the general public. So it means that anybody could show up at a healthcare center and fill in a form and submit it to us to give us a sense of whether people are washing their hands. And so we feel this kind of sense of being watched and sense of doing the right thing for the common good. We know those are universal motivators, so we tend to try and use those in our program, and we do tend to do some research, but it's not just for hand washing with soap. We also use it in communities when we try and change behavior for open defecation. We're doing it now for safely managed sanitation because we need to sensitize households to the fact that the pit under their house is cross-contaminating their water supply, and most people don't know that. So for some things, it requires a really powerful approach, like when I was showing you the data on hand washing versus mask use versus social distancing, people just intuitively know that a mask is going to protect them. It's just like it's physical, they can feel it, they feel safe, everyone can see it. Social distancing, kind of the same thing, but hand washing is really hard because people can't see it or feel it. And so, we need to do different things for that. So for the same thing for safely managed sanitation, people aren't seeing what's happening under their house. It's more convenient to not think of it. Sanitation, poo, it's like so unattractive to talk about that people just tend to not want to talk about it. Sometimes the approach is just to actually break the taboo, start talking about it. And, when people start learning more, they're actually quite engaged. So we do a lot of behavior change for different reasons. And I think, when we're talking about trying to get households to get better sanitation systems, it's often because we want them to spend money too. We want them to upgrade the system, and a lot of the financing comes from the household. So all these different campaigns, have different issues at their heart, and we try and target them based on what we know of what motivates people and the science that we have developed over the years. But we also try not to do it every time. It's expensive and it's hard to keep doing formative research on these behaviors. And more we're seeing, commonalities between what motivates a behavior in one country. You'll have to tweak it, obviously, but we don't have to reinvent the wheel every time on behavioral science. McKenna.
Yeah, I was just wondering what changes you had observed just in the reception of hygiene initiatives in times of COVID. Has there been like a change in attitude? Do you think people are more receptive? Do you think it could be something that's long term?
Yeah, I think that's a great question, McKenna. What we know is typically when you're in a pandemic situation, people are so terrified that they wash their hands like a million times a day. And that's what we were finding, maybe the first few months of the year. Everybody was just becoming like active hand washers, and it was great. Now I see it less and less, and it looks like the numbers have dropped. And that's consistent with sort of the evidence we've seen around the world in pandemic times. So I think so the levels of hygiene have definitely dropped. And that's why we are sort of redoubling our efforts now to look at more clever ways to do this, to sort of normalize it and sustain it over a long time period. And we think that one of the best ways to do this is to get lots of people and lots of partners on board. So you're kind of cued to do this wherever you go. So like there's a guy standing at the door, you have to do it. You go to your office and it's like, the hand washing station is, or the sanitizer is right at the door. So you see it. So we kind of want to make the behaviors more automatic somehow. And so that is the challenge now. We want to just keep the messaging high. So if we get all the big soap companies, now starting to put out a little bit more public health messaging in their soap advertisements, that, might be another way of doing it. But and then getting all the health workers trained up in how to do this and them spreading the word, they become a huge ally in this, need to get hygiene behaviors up significantly.
Thank you very much.
I have a question from Ananya.
Hi, Anne. Thanks so much for joining us. This was really interesting. I'm curious what you think might be some of the largest challenges to building sustainable partnerships in this sector, like you were talking about earlier.
That's a good question. So it's Global Hand Washing Day on Thursday this week. So I expect you all to, be washing your hands on that day and checking out some of the events that are going out on. But in Indonesia, we're launching a huge partnership between the government and some companies, and we're calling it the Hand Washing Business Coalition, and hoping that the government and these companies can work together to promote hand washing. And I think there is going to be a challenge to sustain this partnership. And in fact, I know that, over 20 years ago, they tried to do this and it failed. And it's unclear to me why it failed back then, but I'm starting to see that, I think without the urgency of a pandemic, it's hard to keep the agenda high. And so what we are doing differently now is, trying to engage the government as a lead on this. And before it was an NGO or it was some kind of a development partner, but now we've got the Ministry of Health that's actually leading this coalition with the private sector, and I think that's really important actually, because that gives them credibility. It makes them have to work together, across sectors, and make them feel involved as real players at a national level. So I think having some kind of neutral facilitation is really important. And so UNICEF has provided the facilitator of that group, but we have the leadership coming from the ministries, and we've got this very special context of COVID where this is so important that I've got 4 ministers that are going to sign a national call to action on Thursday in Indonesia. So we're taking the opportunity of the COVID crisis to raise a lot of noise about hand washing in Indonesia, but we're also coupling that with like a plan of things that each of the agencies can do. So I don't know, I mean, to answer your question, how do you build these partnerships? I mean, with great difficulty. They take a lot of work, they take a lot of ongoing, but I think having a context that necessitates all these different partners is good. And I think a really key part of this is if you can identify really clear roles for everyone and they all know it, and that will be a factor for success in this particular partnership.
Thank you.
Welcome.
Yeah, I'm not able to raise my hand, so I was just waiting for a time to jump in. But I'm actually so fascinated by the data you presented. So thank you so much for that, Anne. I'm probably most interested in the fact that you've kind of put into numbers something that I've heard some people discussing, this idea that hand washing really is not prioritized in terms of a way of, like, the first way of and most effective way of preventing COVID-19. And so my question, I think, is, has there been talk of really trying to just put more emphasis on the relation between, I think that it's pretty well clear established, at least in the US, I'm not so sure about Indonesia, that hand washing is very much tied to using the restroom, but I don't think it's nearly anywhere tied as much to just, you know, going somewhere and then washing your hands after, or washing your hands before you enter a community space. And so I was interested in like how you're responding to those data, and then also like that general idea of hand washing not being as emphasized as it should be.
Yeah, no, I mean, I've been working on hand washing my entire career, and I'm really passionate about it because I agree it's such an easy thing, but it's actually such a hard thing. And I mean, for me, it's always been this, how do you make it visible to people, right? Because if I go into a supermarket, even before COVID, maybe because of what I do, I don't even like touching the handles on a shopping cart because I know how many people have touched it. And I also have way too much data on how many people don't wash their hands after they go to the bathroom. And, you know, it's just, for me, germs are everywhere. I have, you know, when I worked in New York, we did a study at Penn Station, and it showed that people weren't even washing their hands coming out of, you know, in the train station, coming out of the bathroom. It was just disgusting. I mean, at UNICEF, we did the same study, and I have to say, I'm ashamed to say the rates were really low. And it's just a thing, you know, people don't wash their hands unless they think people are watching or there's something going on. So it's not even high after the bathroom, let alone in all these other contexts. So it's really exciting for me to see all these hand washing fanatics in Indonesia now. But at the same time, I know it's short-lived, and so it really is a challenge. How do you keep this sense of like dread and fear of germs alive? I think you know, our best hope is with kids, because I think if you can inculcate that sense of disgust early in their lives, it's fantastic. You know, I'll give you the example of my son. He's 5 years old, and he has just become a hand washing fanatic, a mask fanatic. And even now when he goes to his tennis lesson, he wears his mask, and he will not let anyone talk him out of wearing his mask. But I just mean, like, you know, these kids, they get it in their head, and there's real hope that they will grow up with this sense of, you know, hygiene being a protective barrier. But I think for adults at the moment, it's the behavior has to be cued, or they have to, you know, feel like they're being watched. I don't have the answers on that one. I think it's a very difficult question of how do you sustain this, and not just around the bathroom behavior. I think sanitizers are starting to play a role, and it's possible that, you know, I have this fantastic product I want to show you that a company in Indonesia just innovated that I think is such a great sanitizer, and it's actually raised my level of sanitizer. I don't know if you guys have something like this, but it looks like a pack of gum. And they innovated this during the COVID crisis. It's a really tiny, super inexpensive thing, but it's super discreet. You can carry it in the back of your pocket, and you spray it on your hand, and you're done. And I love it. It's my favorite thing. It just slips into my wallet. I feel like I'm running an ad for it, but you know, innovations like that might help people when you start seeing that maybe hygiene can be nice, and if it smelled good, it would be better. It doesn't really smell like anything, but it's all this behavioral science that we need to play with to figure out what makes people want to do this habit more regularly, what makes it easy for them, and like something they don't think about.
That's so interesting. Thanks. Love that.
So I don't see any other hands. And did anybody else have a question that doesn't know how to raise their hands? Okay, well, I'm on campus for a couple more days. So if any of you have any questions, I'm happy to respond by email, and I'll just put my email in here for you. And you can reach out to me. I wish you all luck and success with your future careers, and I hope they are as interesting and disgusting and fun as mine is.
Thank you so very much, Anne. I appreciate it. I know the rest of our leaders, as well as all of our participants today, I really appreciate it. I've been getting messages, private messages from so many people talking about how interesting your data and presentation have been. So thank you again for joining us. And I'll definitely be reaching out. Very, very interested in the work that you do.
Perfect. Thanks so much to you all for organizing this. Take care.
Of course. Bye, everyone.